Hello, my name is Catherine Porras, and today I will be demonstrating IV fluid and medication administration. So first, I'm going to perform hand hygiene, and I'm going to put on some gloves. Okay, and then I have gathered all the supplies that I need. I have a 100 milliliter normal saline, simulating amoxicillin. I have the 250 milliliters normal saline, which is going to be the primary IV fluid. I have my primary. I already opened it. And I have my secondary tubing, both with 15 drops per milliliters. And then I have alcohol prep pads, and then my gloves, and then I have a whiteboard with the calculated drops. I have verified the physician's order and confirmed the 6 rights of medication administration, which are the right patient, right drug, dose, route, time, and documentation. I also confirmed that the patient doesn't have any allergies. So now I will identify the IV tubing parts. Okay. So the primary tubing, I have the spike. This is where I connect the IV bag. I have the drip chamber to count drops and prevent air. I have the roller clamp to adjust the flow. I have the white port for medications or secondary infusion, and then the adapter, and to connect to the IV catheter. Okay, now I have the secondary tubing. I have the spike, the drip chamber, I have the roller clamp, and then the adapter end to connect to the white port. Okay, so next I am going to spike and prime the primary IV fluid bag. I will fill the drip chamber halfway, and then I will remove any air bubbles. Okay, so now I will hang it at least 30 inches above the IV site. Works for now. Okay. So the order is normal saline at 150 milliliters per hour, and then using the tubing strip factor, which is 15 drops per milliliter, I calculated 38 drops per minute, and then I will just adjust the roller clamp and count for 1 full minute to make sure I have 38 drops. Before I put it to the patient's peripheral catheter, IV catheter, I have to make sure that there's no redness or anything. Just make sure the IV site's fine. Okay, so now I am going to prepare the secondary medication, the amoxicillin, 250 milligrams in 100 ml, to run over 15 minutes. Okay, 100 ml over 15 minutes. 15 drops per ml is 100 drops per minute. Okay, so again, I have to confirm the 6 rights of medication administration and verify that there's no allergies. So I check the expiration date and ensure the medication looks normal. Okay, so now I am going to prime the secondary tubing. Okay, so now I'm gonna hang the piggyback bag above the primary bag, and then okay, that looks good. Okay, so now I'm going to clean the white port. This one right here. With an alcohol swab, and I'm gonna allow it to dry, and then I'm gonna connect it to the secondary tubing aseptically. So the medication runs over 15 minutes. So using the 15 drops per milliliters tubing, I calculated 100 drops per minute. And I just adjusted the roller clamp, so now I'm gonna count for 1 full minute to make sure that there's 100 drops per minute. Okay, so that was 100 drops. During the infusion, I will monitor the IV site for redness, swelling, or any allergic reactions. After finishing, I will make sure the patient is comfortable, ensure the call light and the bedside table are within reach, remove the gloves, okay, perform the hand hygiene, and document the procedure, including the line expectancy and the patient response. Sorry, thank you.